Thank you, Joan. Joan, I'd like you to explain to both the people here and what Dr. Betty and I have gone over with you as regard to what's going to be done today, what brought you to pursue having this done at this time.
All right, then I can just start a little history.
A little history.
I unfortunately did develop a very, well, I would say serious case of periodontal disease, and I sort of didn't face up to it right away, so that I postponed having anything done. But then eventually, as all things, you have to face up to what your problem is. So that's how I arrived at your place, because I thought in doing the operation and removing the teeth that had to be removed so that the bone wouldn't erode anymore, I thought maybe I could go into some implant work. I must admit, this implant procedure that we're doing is a lot more than I had thought, but I'm hoping it'll be the answer for me for a better quality of life. I had the lower dentures made, and they're very good. But unfortunately, because I have been a little low on this side, it bothered me sometimes to eat, because the food would sort of work its way under the plate, and you can't just very well get up and go in a restaurant and remove your plate and clean it all off. So I thought, well, with the implant situation that you described, that might solve some of my problems.
What got you motivated to consider doing this teeth in a day or teeth in an hour
my husband was a
procedure?
very big supporter for me, because I kept avoiding the taking the teeth out. I kept avoiding that because I didn't want to face up to the fact that I would have nothing there. And Paul just pushed me and pushed me. He's always been a good supporter of me. And I realized that he was right. I realized he was correct, and I just decided I would go into the implant world, if you want to call it that. And is there anything else you'd like to?
What's your expectation of having the implants done?
Well, this particular procedure is a lot better than I had anticipated. I anticipated just having something to anchor my lower denture, but I saw this procedure on Channel 5 in the local area from Good Morning America that was done in Pennsylvania. And lo and behold, I found that you two people, you two, Dr. Betty and Dr. Mariani, was attempting to bring that procedure here, so I thought I would look into it.
Are you excited about the fact that with this procedure that we are going to do in a couple of minutes from now, you will have your full complement of teeth on the lower, and almost something like instant gratification?
I'm Irish and I'm skeptical, and don't get me wrong, I have a lot of faith in both of you, all right? It's just the idea, I'll wait and see.
Fair enough. Do you think that doing this procedure, because of the way we're doing it today, is it going to be a benefit to you because it's involving minimal surgical invasiveness?
I would hope so.
Because of the fact that you are on Coumadin periodically.
That's right.
Okay.
I have a condition called atrial fibrillation.
Right.
Otherwise, I'm healthy,
Right.
but in that condition, it's behooves you to be on Coumadin because it stops any blood clots from forming.
Good.
And I'm down to 1.1 today, and
I know.
want to run home and take my Coumadin.
All right.
In your opinion, you think it's going to help you eat a lot of the foods where you may not have been eating presently with your dentures?
That's right. Sometimes there's like I have really sort of gone off eating meat because I'm not crazy about meat anymore. But I think it would be nice if I get to Whole Foods and get one of their steaks or something. And I imagine there will be a little bit of eating soft food for a while, right?
Well, for maybe a few days, but hopefully at the end of this procedure, we'd like to have you bite into something,
Mhm.
and where you could pretty much have and enjoy immediate function with these teeth.
Oh.
Is what the goal is. Yes.
Well, that's a miracle.
I think with that, we should
Good.
get started.